case of the day and back with another case, another week, and I think we're almost now 8 months down. And this is a case where I got the images, got to see the images today. Though it's been discussed with the referring physician for the last 4 or 5 days, and I'd like to, and this is a shout out to the referring doctor who I won't name for confidentiality issues, but if you're listening to this, you know who you are, and thank you so much for getting me all the information. As usual, no AI used, and that's the 144th case, the importance of the portal. So, this 47-year-old diagnosed to have CA lung in April 25 presented recently with type 1 respiratory failure. Chemo radio, last dose of radiotherapy was in July 25, and then on targeted therapy. And this is the recent CT scan done about 5 or 6 days ago. And we can see here consolidation, air bronchograms, normal proximal bronchi, right upper lobe, superior segment lower lobe, right middle lobe, and the left upper lobe. So, multifocal, bilateral, asymmetric, not respecting fissural boundaries, but you see sharp margins and a little bit of peripheral ground glass. And so, is this infection? Is this radiotherapy-associated lung injury, which is the new term provided by the new guidelines? Is it chemotherapy or drug-induced ILD, or is it a combination of everything? And it's difficult because if it's bilateral, asymmetric, multifocal, you would think of infection, you would think of chemotherapy. All of these things become relevant. And that's also because of the left upper lobe pathology. The only thing is, if I go back, the margins are sharp, and that's a little unusual. And so, when it came to me for an opinion, I said, if we could just get to understand the radiation portal, perhaps things will become clearer. And finally, with a lot of effort, the portal images were made available, and you can clearly see here that the portal includes the left upper lobe exactly where this opacity is. And while the left upper lobe was not involved in October, and so the radiotherapy ended in July, 3 months or 2.5 months later, there are post RT changes around the lesion, and then 6 months later, along the timeline, there's been a flare up, and that is known, where we have from an exudative phase, an organization phase, and progression, which is also known to happen and involves the left upper lobe, and everything is along the portal, including the lesions in the right, middle, and lower lobes. Again, not respecting anatomic boundaries. Recently, these guidelines have been published on radiation-induced lung injury, and this is a flow chart. We're not going to talk about radiation recall pneumonitis. One of these days I'll get a case, and there is a case up on ctchestreview.com if you're interested, and you can go ahead and look at it. But less than 6 months or up to 8 months, you have radiation pneumonitis and organizing pneumonia. So that's what you would get up to 8 months, confined to the radiation field, not conforming to anatomic boundaries. Patterns are consolidation, ground glass, organizing pneumonia patterns. They usually regress, sometimes become fibrotic. And I did do one case in 2.5 or 3 years ago, where I showed a lot of patients with CA breast related radiation changes in the subjacent lung, and there is a link in the top right corner if you'd like to go through it. So, in patients with thoracic malignancies, including breast, who've received radiotherapy, development of opacities that don't respect respect anatomic boundaries and have sharp margins should raise the possibility of radiotherapy associated lung injury, keeping in mind the fact that it could as well be infection or chemotherapy related. So we need all the information, which drugs, timelines, the portals for RT, which rarely do we have, right? As radiologists, we're just told CT chest, known case of CA lung, and that's it. And then we have to get all the information. And so if you're a physician or surgeon listening to this, or a radiation oncologist, give us more information when you send the patient for CT or PET CT. That's a request. I mean, this is, we're all short of time and all of that, but maybe we should have a system that allows us to get more information. Rad Protect now, about a month from now. My WhatsApp channel. Thank you so much for viewing this.